Hey NICU mamas, today we're exploring a topic that many of you may have questions about: breastfeeding and pumping in the NICU. We know that every mom's experience is unique. From the emotional highs to the challenging lows, we're here to explore it all. Whether you're breastfeeding, pumping, figuring it out along the way, or deciding if you want to even try it, this is a space of support and understanding. Let's dive into a crucial aspect of breastfeeding and pumping in the NICU: the stages and phases of feeding your preemie. Understanding that these phases are not only insightful, but they also play an important role in your journey of breastfeeding and pumping. Depending on the gestational age of your preemie, they may start on a nutritional boost called parenteral nutrition. This is a vital infusion of nutrients directly into your baby's bloodstream, ensuring that your baby gets the sustenance they need for growth and development. As your little one grows stronger, their team may move them to a significant step: Gavage feeding or tube feeding. This involves delivering a measured amount of breast milk, formula, or a combination of the two through a tiny tube that is inserted in your baby's nose or mouth, and it goes directly to their stomach. It may seem overwhelming at first, especially seeing this, but the NICU team is there to guide you. So if you have any questions, be sure to ask either your nutritionist or your baby's neonatologist. The Gavage feeding stage allows for precise feeding to ensure that your preemie gets a specific volume of breast milk, formula, or a combination of the two for the development and growth. As your little one progresses in the NICU, the team will start transitioning them from tube feeding to a mix of oral and Gavage feeds. This marks the beginning of the journey to breastfeeding and bottle feeding. Every NICU may have slightly different benchmarks for graduating to oral feeds. The NICU team will assess your baby's readiness for this transition based on a few key indicators like reaching 32 to 34 weeks of gestational age, showing the ability to suck, swallow, and breathe simultaneously, sucking your finger or a tiny pacifier, maintaining stable vital signs, or being off the ventilator. If you're exploring breastfeeding, your NICU team may allow you to start this stage a little earlier, as they may introduce the nippling stage. Be sure to ask your NICU team when you can start this. Nurturing your preemie on their feeding journey is filled with moments of joy and undoubtedly challenges. So let's explore some of the challenges you may face and tips on how you can navigate them as it relates to pumping in the NICU. Establishing and maintaining milk supply. Premature birth, stress, and separation can impact milk production. Many preemie moms experience delays in milk coming in after birth. So when you are able, initiate pumping frequently, if that's something that you decide to do. Seek guidance from your hospital's NICU lactation consultant, who can help create a personalized strategy and plan based on your unique situation. Also, ask about renting a hospital-grade pump for your home use, as it can be more effective in establishing and maintaining milk supply. Lastly, take care of yourself. I know that balancing the NICU visits and pumping and your own well-being can be extremely demanding. So remember to eat, stay hydrated, and rest when you can. Consistency in pumping routine. It can be a challenge to maintain a consistent schedule amidst the unpredictability of the NICU environment. On top of that, life doesn't pause outside of the NICU, so juggling work and other children and distance from the hospital can all impact your pumping routine. Reach out to your lactation consultant about pumping and your schedule to see if you can maybe try a few things and a few strategies to keep your schedule consistent. You can also ask your lactation specialist about pumping stations in the NICU. Now, pumping stations do require a little bit more cleaning because it's shared equipment, but you'll be closer to your baby, and you can potentially plan your pumping sessions around your baby's care routine. You can also download pump tracking apps and set alarms to remind yourself to pump in order to maintain that consistency. Pumping, especially in the NICU, can be especially taxing emotionally. So some moms may experience feelings of inadequacy and guilt when they can't be consistent. At your home or temporary housing, consider creating a comfortable pumping space filled with drinks, snacks, and your pumping parts, all within reach. Also, connect with other NICU moms for emotional support. I found this especially helpful in my journey when I had a lot of challenges that other NICU moms could relate to. Storing and transporting breast milk from home or your hotel to the NICU can be a logistical challenge. It's essential to ensure that your milk is handled and stored properly so that the milk bank can use your milk. We don't want spilled milk over here. Some milk banks provide one-time use storage containers, labels, and instructions. You can ask your lactation specialist or someone in the milk bank about their guidelines and best practices when it comes to milk storage and transport. Breastfeeding is already a challenge, but breastfeeding a preemie in the NICU comes with its own set of challenges. You may encounter more hurdles than you anticipated in your breastfeeding journey. So let's cover some of these challenges and how you can navigate them when it comes to breastfeeding. Premature birth can sometimes impact a mom's ability to produce milk. Stress, medical complications, and the emotional roller coaster of the NICU can also contribute to a low milk supply. This is a common challenge among preemie moms, so it's crucial not to be too hard on yourselves. Work closely with the lactation specialist and try different techniques to promote consistent pumping and creating a schedule and exploring techniques that will help you enhance your milk production, such as kangaroo care or power pumping. Another critical aspect of navigating the complexities of the breastfeeding journey in the NICU are latch and positioning. Achieving a good latch and a comfortable position may be a little bit trickier in the NICU. Your baby may be connected to wires, or finding the right balance may be a little bit more difficult. It's a learning process. So be sure to work with your lactation consultant on different techniques for latch and positioning, and maybe try breastfeeding pillows or experiment with different holds until you find the best position and the best comfortability for you and your baby when it comes to feeding. One common challenge is the inconsistency of pre- and post-feeding weigh-ins. Preemies, being delicate, might have a little bit of inconsistency when it comes to transferring milk during breastfeeding. It is also important to note that the method of weighing and even the equipment used may cause fluctuations in the readings. For example, if your nurse doesn't weigh your baby the same way before and after feeding, it can cause the numbers to be a little inconsistent. Machine inconsistency can also add another layer of complexity when it comes to pre and post weigh-ins. And when you're literally monitoring progress of weight gain by grams, weigh-ins and inconsistency can be emotionally taxing. Know that these pre- and post-feeding weigh-ins are not a reflection of your efforts or your capabilities as a mom. To help with the consistency in the style of weigh-ins, ask the nursing staff what the weighing process should look like. As a parent, know that it is okay to seek clarity so that you can get consistency in these weigh-ins and so that consistency can be established. Unfortunately, with preemies, weight fluctuations are possible. So trust your gut when it comes to fluctuations of the weigh-in process. And if it's bothering you, reach out to the charge nurse to really get an understanding of what the weigh-in process should look like. It's time for our tiny treasure. When it comes to feeding your preemie, it's essential to know that you have options. Whether breastfeeding, pumping, or a mix of the two, it is your choice, even if you decide not to do any of them. This journey is uniquely yours, and if you're feeling overwhelmed, trust me, you are not alone. Having been through this journey myself, I understand the challenges that you're facing. Every parent's journey is unique, and the challenges are unfortunately a part of the process. Whether it's latching difficulties, low supply, pumping obstacles, or the emotional strain, these challenges are all normal. Every feeding milestone is a victory. Whether it's the first latch or the successful bottle feed or the steady pumping routine, celebrate all of these moments because they matter. However you choose to feed your baby, your dedication and your love for your preemie are remarkable, and you are not alone in facing these challenges. Seek support, celebrate every milestone, and trust the instincts that you have to navigate this challenging process. Thank you so much for joining us. We hope that these tips and strategies will help you navigate breastfeeding and pumping in the NICU. Don't forget to subscribe, hit that like button, and share this video with others who might benefit. To every NICU mama out there, whether you're breastfeeding, pumping, or a bit of both, know that you are doing an incredible job.